and welcome to this maiden edition of LifeLines on Manor Reporters. I am Kemo Cham. In this program, we will give you news, reports, and analysis of science and health stories of the week. In this week's edition, Sierra Leone takes lead in Mpox transmission in Africa. Health authorities grow worried in the face of flaring cases as the Clad 2B strain that is circulating in the country proves more virulent than anticipated. According to the Africa CDC, Sierra Leone is now on the top of the list of countries most affected by Mpox. Sierra Leone joins DR Congo, Burundi, and Uganda as countries that account for the largest number of cases in this epidemic, which began in mid-2023 and has since spread to over 20 countries. Burundi has since shown improvement in controlling the spread of the virus. Latest data from the Africa CDC show that Sierra Leone, DR Congo, and Uganda contributed 90% of the cases, and Sierra Leone accounted for half of the number of cases, placing it at the head as the most affected country. Sierra Leone is one of the last among the countries transmitting the virus to record a case. The health authorities had said that the country was well prepared to ensure the virus didn't spread out of control. But a recent assessment by a team from the Continental Public Health Agency suggests that it was in fact unprepared. Dr. Ngashi Ngongo, head of the Incident Management Support Team at the Africa CDC, explained what his team found out about Sierra Leone's preparedness during a week-long assessment tour.
Observed, I think from the Minister of Health, the most important thing is that funding is the main issue. That is from the government side. Funding is the main issue. From the IMST, we also understood that funding was a main issue because the system is weak. For example, the system is weak, that it needs to be strengthened. And when we look at in this current response, surveillance is still mostly passive surveillance. That's why you saw the positivity rate, in Sierra Leone, that is far above 50%. It means that the people come when they're already very advanced. They come on their own to seek care instead of active surveillance that can pick them early and shorten the exposure of the population.
The National Public Health Agency did admit last week that its strategy wasn't working, and it announced a series of new measures geared towards breaking the chain of transmission. Among these is home-based treatment. Before now, people with confirmed positive cases were asked to treat themselves at home. And according to the Africa CDC, this was part of the problem that led to the escalation of cases.
In the capacity to provide care for those that have already been tested, you saw, for example, when I presented, only 60 beds that are there to take care of 800 people. Now, as a result, that most of these people are at home, and then even compliance with IPC is a problem. You see somebody who's on home-based care, when there's a family funeral, that person leaves for the home-based care, goes to attend the family funeral, and comes back. I think those are the things that we think are extremely important, that there are those areas that have been identified. Surveillance is a priority area. Laboratory is a priority area. Case management capacity in the country is a priority area. On the vaccination, we are bringing the vaccination. I think that's not a problem. But for those three, we agreed on the clear strategy to implement that. But above all that is what government is also wanting, the resources that can help them then intervene in those areas, technical areas, to be able to get a much stronger.
Professor Fodesa, Executive Director of the National Public Health Agency, addressed journalists at a press briefing at the Emergency Operations Center of the Ministry of Health on Tuesday, May 6th.
We want to manage all positive cases now in health facilities.
As the authorities work with regional and international partners to put the virus under control, there are other pressing matters for the relevant experts to deal with. Among these is getting people, particularly those most at risk, vaccinated. Also, some emerging realities of the virus have been keeping epidemiologists restless. One of the main concerns is that the strain in transmission, Clad 2B, turned out to be more virulent than was expected. This has resulted in patients presenting with severe form of the symptoms.
We saw in our genomic profiling was that the virus will continue spreading until 2028 if we don't take the appropriate measures. And the results also indicate that there is some mutation occurring in the virus. So therefore, you're seeing our cases today in Sierra Leone somehow different from other outbreaks. But we are told by literature and other research that we are dealing with Clade 2B, which is the West African clade, seen in Nigeria, Liberia, Guinea, and other countries. As I said, this outbreak is occurring not only in Sierra Leone, in other countries as well. But the level of virulence of cases we are getting now, severity, especially with the genital lesions, both male and female, we are thinking otherwise. That yes, this is serious. This is not what we thought of initially.
People's genitalia are really getting very infected. In some cases, the penis is dropping out.
Sierra Leone was the last country in the Mano River region to record a case of Mpox in the current epidemic, after confirming its first case on January 10th this year. That was followed immediately by the declaration of a public health emergency. Minister of Health, Dr. Austin Demby, said at the time that the move was necessary to prevent the virus from further spread. But 3 months later, Sierra Leone is now among the top 4 most affected countries. While this may sound worrying, officials believe that it is an illustration of the effectiveness of surveillance measures put in place to identify and treat patients. The agency therefore says it is intensifying effort as part of the ongoing Operation Find Them All. Vaccination is one of the greatest tools in the arsenals of countries fighting the virus. Luckily, Sierra Leone is one of 10 countries to have received vaccine supplies, thanks to the support of partners like Gavi, UNICEF, and the Africa CDC. But with a population of 8 million people and just a little over 61,000 doses of the vaccines available, it is a pretty tough decision to be made by authorities. Dr. Desmond Mada Kangbai, manager of the expanded program on immunization, who is the Mpox vaccine lead, explained how he intends to deal with this situation.
These are not enough for now, not so. So, and we are really focusing on those contacts, people that have been exposed, healthcare workers, so that we give them the vaccines. Because if we just randomly give the vaccine to anyone at this particular point, we'll end up not reaching our target.
I also raised this issue up with Dr. Yap Boom, Deputy Manager of the Africa CDC's Incident Management Support Team. I asked him about the chance of a country like Sierra Leone to get more allocations.
So it's important to highlight that we recommend vaccination, but vaccine is not a silver bullet. We've shown the example of Burundi, who have managed their response without the vaccine, but this is a specific case. They've relied more on the active surveillance, the lab decentralization, and the good IPC, which means isolation of cases as soon as we find them. And Sierra Leone is implementing a good response. They launched the operation Find Them All by the deployment of community healthcare workers trying to actively track the patient in the community. At some point it was stopped, but we've heard that they have resumed. We have a team. So we believe that all those activities will help the country to use all the different pillars. Vaccination is one out of 10 pillars of the response to Mpox or to other outbreaks. Now, on the side of the allocation, definitely the allocation will rely on how the outbreak will continue. But it's important to know that the number of those available at the global level is quite limited. That's why we really encourage a targeted approach. So we've seen, for example, I think around 700 people have been vaccinated in Sierra Leone, but it is critical to vaccinate the right population, which are the most at risk, the contact and the contact, also to vaccinate the sex workers, all the people who you find are positive within the epidemiology. So that's the kind of support that is being brought to the country so that they use the resource that we have. Now we are in an era where we need to do more with less.
That is all we have for this week. Thank you for watching and see you for more next week.